Welcome to our special NRI show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Pallavi Patel, an occupational therapist. Her organization, Steps to Success, strives to provide quality services to help children and adults with various needs to maximize their learning potential in the most fun and safest environment. Their goal is to be a resource for families in the community and with the skills necessary to grow and develop independence to their highest potential. They offer a variety of services like screening, assessments and evaluation, therapeutic exercises, neurodevelopment treatment, sensory treatment, and vocational skills and life skill training. So without any further delay, let us welcome her on our show. So hello, Dr. Pallavi. I hope you're doing really well.
Thank you, Shivani. Yes, I'm doing pretty well.
Yes. So, Dr. Pallavi, I was hoping if you could introduce a little about yourself and what you do and a little bit about your organization, please.
As Shivani has mentioned it, I am an occupational therapist and I'm very, very honored to be here today because this is April is an occupational therapy month. So this is a perfect platform to educate you all about what the occupational therapists do. So I'm an occupational therapist. I do predominantly see children on a spectrum of autism and various disabilities. I'm a founder of Steps to Success Occupational Therapy. We do various kind of activities and different age of the children that we work with. Besides doing just the work, I'm also very involved in my community, where also we do a lot of health fairs, charity functions, and anything where children are in needs.
Yes. So, doctor, everybody knows that it is the Autism month this month. So, I was hoping you could explain a little about what exactly is autism.
Sure. Yes, this is also an Autism Awareness Month. So, as many of you probably here in New York, we have many children who gets diagnosed with autism, and I believe around the world as well. So autism is a condition that is a lifelong condition. A lot of times people have a question, do children with autism get cured? Unfortunately, it is a lifelong condition. So those children with autism, they will need a lifelong therapy. And that's where we as a professional comes, occupational therapy, physical therapy, speech therapists. If you have kind of like seen any child who has a poor eye contact, poor joint attention, their delay in the speech, those are the population we are talking about right now. Autism is a kind of condition. It's not a disease. It is just a gap of the communications. So the way we communicate, children with autism, they have a difficulty communicating and expressing their needs. And there are many resources available, which we will definitely talk about it. But if you see anyone who has an autism, if you have seen a child who has a poor eye contact, they don't have a joint attention, they are playing in the corner of the room, they are playing by themselves, they are just laughing or smiling without any purpose. Those are definitely some of the signs that you want to be aware and you want to make sure that child needs the help.
Yes. So, doctor, are there any different kinds of autisms, and at what exact age can a child be diagnosed with autism?
Yeah, great question. So a lot of times when as a parent, especially as a mother, it's very hard to accept. So when you have a little child and he's only 16 months or 15 months, we have this mentality like, 15 months or 16 months, children have to play. They don't have to do anything. However, if you're seeing your child is not giving you eye contact, when you're calling the name and child is not responding, not looking at you, not smiling at you, poor eye contact, play skills are not there. Instead of playing the toys functionally, sometimes you see the child is just banging the toys or throwing the toys. Those are classic symptoms and signs that you want to be aware. And when do you see this? Around the age of 16 months to 24 months, you start seeing these symptoms. So when your child borns, child will have eye contact. Child will be looking at you, smiling at you, you're talking to the child, and you feel like your child is with you. But as soon as child turns 16 months old, from 16 months to 24 months, you will start seeing some of the symptoms like flapping hands, spinning round and round, playing by themselves. Sometimes another main point is that you have to also think about if their speech, if they're not talking, if there are no words. A lot of times parents will feel, oh, my child is delaying his speech. I was a late talker. My husband was a late talker. In our family, everybody talks late. But at this time of the world, not necessarily. It can be not just the speech problem, it can be more than that. So it's very important as a parents, look for those small signs. Even not as a parent, just as a community, for your friends' children, for your relatives' children, look into those signs. And if you are aware of these signs and if you're educated about this topic, you'll be able to help someone who really needs help. But definitely, I would say between age of 16 months to 24 months, you will start seeing these symptoms.
Yes. So, doctor, how can a parent recognize these signs and what exactly should they be doing first?
So as I said, if you are the parents and you're seeing your child is only playing repetitive play. So I'll give you an example. Your child loves car. It's a boy. Boy loves cars. So instead of playing cars like back and forth and exchanging with you, if the child is just pushing car back and forth in the same directions, same repetitions for half an hour, for 1 hour, that is not a good sign. If you're seeing your child is flapping hand all the time or round and round spinning in circles, those are not good sign. If you see a child is walking on the toes, on the tippy toes, those are also not good sign. The main sign with the autism is poor eye contact. Those children are not looking into your hand. So if you're giving a child a toy, instead of looking into your eyes and taking the toys, they are more focused on the objects rather than people's eyes. So no eye contact, that's a big sign also. Some of the children you will also see gets very easily upset. They are crying a lot. Or children who has a hard time with the eating, very picky eater. Children who has a hard time bath time. Different kind of clothes bothers them. Even the tag on clothes, sometimes they will bother. And those are all kind of signs. If you're seeing some of those signs, not necessarily every children will have the same all signs, but even if you're seeing some signs, you speak to your doctor. Usually in United States here, we have a psychologist or social worker, clinical social worker. They are able to diagnose the autism. I'm not too sure how it's in India, but usually psychologist is the one that who kind of able to diagnose if the child has autism or not. And so first thing is just look for those signs. And in your heart, if you see that this symptoms you're seeing, it's something different. My child is a little different than other children's are. I'm sure that your heart is telling you the truth. So listen to that, look at those signs, speak to your doctor, and just get evaluated. Even if child doesn't have autism, it won't harm you to just get tested.
So, doctor, in your experience, how do you think our Indian parents accept or seek help?
So very good question. As a parent, it's not easy to accept when it comes to your child, especially even if your child is not doing well in a simple math test. It's very hard for parents to accept it. And autism is not a little thing. It is a big, big term. When you throw to the parents that your child has autism, it's not easy. And knowing that this is a lifelong condition, it's not that autism is for only 1 month or 6 months or 1 year. So accepting is a big thing. However, I would definitely say with my work experience here in New York, our parents are being more educating about these topics. And that's why it is very important. And I'm glad that today we are using this topic here, because more the education you have about this topic, then you kind of like think like, okay, autism is not just a disease. It is not something you can just left out. And you also understand that it's important to recognize and help your child. So most of the times what happens when we go to the people's home for like doing evaluation, parents will be in a denial, which means they will say, oh no, he's just a delay in his speech. And maybe in a few months, my child will start talking. A lot of times parents will say, oh, we will take the child in our country, because in our country, we have more kids. In United States here, you only live in your house, you don't play outside. That's why my child is not talking. So there is a time that parents has a hard time. However, I feel like autism awareness, it's so well spread all over the world now. So parents are more computer savvy. They are looking at the computer, they are looking at the Google, checking out some signs and symptoms. And more often also the families and the caregivers or the friends, they're also informing if they're seeing anything. So it's still a hard topic when it comes to a child to accept if the child has an autism, but I feel like with more education, parents are now really accepting it. They are seeking for the help, and they know the help is available, especially in the New York City where I am practicing. We have so much help. If your child has an autism, it's the earliest. They can diagnose them, they can give all the therapy that they need, and the child really starts making improvement.
Yes. So, doctor, what is the prognosis of children with autism?
So very good question again. So prognosis is really depends on the child. So let's say if you there is no set treatment for children with autism. If you have a 500 children with autism, every child has a different treatment they need. So there is no similar, it's not a cookie cutter treatment that, okay, I will prescribe you this treatment or this therapy, and then Sivani can use this therapy too, and Pallavi can use this therapy. It doesn't work like that because each, as you know, each child is individual, right? So everyone has their unique capacity, their unique potential. In terms of prognosis, it really helps if the parents are really involved. So therapist comes to the home and teaching you, you have a child with autism and very hyper. Your therapist has shown you some strategy that this is how you have to work, and you really follow those, and you will start seeing the results. There are some children with autism, they have other diagnoses along with autism, let's say mental retardation or learning disability, that also impacts on the prognosis. So if your child has a good therapy from the beginning and the child has a better IQ, their prognosis is more better. However, as I said, each child is unique. They each has their unique capacity to meet. So proper education, parents' involvement, therapy services at early age, proper schooling, special schooling where those children can learn. It really, prognosis is good. A lot of children, they do make it to the college too. There are children with autism go to the college. There are children with autism in adulthood, they are working in the factories or places with the supervision. They are living independently because autism is a big, it's a big umbrella term. So you could have autism mild, moderate, or very severe. But regardless, if you have autism, you have autism.
Yes. So, doctor, can you give few examples to the viewers about what kind of different therapies can be useful for the people with autism?
Yeah, sure. So most of the children, once they diagnosed with autism, the children gets the therapy such as called ABA, which is Applied Behavior Analysis, which is a very structured therapy for the children on autism spectrum, where you have 2 to 3 hours of teacher comes to your home and kind of like really help the child with everything, whether it's sitting on the table and chair, functioning, eating, and all this. There is a children who have as a high sensory needs. When we're talking about sensory, it's pretty much like for all of us too, adults. We have a sensory needs. A lot of times you see people like twirling their hair or shaking their legs or biting their nails. Those are all sensory because you need those little behaviors to self-regulate, correct? So same thing with the children with autism. When you see the children running around or you see the children jumping around, we feel like, oh my God, those are the behavior. These children are hyper. These children are cannot sit down still. They are not listening. No, that's their bodies need that they need. So in terms of therapy comes occupational therapy. We are big in the world of autism because we are the one who are the expert who works on the sensory needs. And I'm sure like if you have seen the children like running back and forth, jumping hyperly, a lot of children also have some aggressive behaviors, which will be like hitting, biting. So that's where the occupational therapy comes. Some children also has need of physical therapy because they are walking on their toes. They're very low muscle tone. Some babies can't even walk or stand properly when they're little. And then main therapy also that they benefit from is a speech therapy because most of the children, they have a very poor expressive speech. When you talk about the speech, there is a two kind of. One is to understand someone who's talking. Like right now, for example, even if I don't know how to talk to you, I may understand what you're talking. And then another part of the speech is when you're expressing the speech. So children with autism, they struggles with the speech and communication part. So services that we have it here in the New York State, we have ABA, we have speech therapy, we have occupational therapy, we have physical therapy, cognitive rehab therapy, play therapy. So those are the therapy services that children can benefit from and to learn what they need to learn compared to their peer group.
Yes. So, doctor, what is the role of the occupational therapy in children with autism? What do you do? How do you deal with autism children?
So, as an occupational therapist, we are the therapy services that we help the children to gain functions like independently. So, we covered a lot of area in when it comes to the children with autism. We are the expert into teaching them how to live the life independently, which contains like their self-care skills, like how to use the spoon, how to scoop the food, how to bring it to the mouth, how to hold the crayons, how to write. All that comes in occupational therapy because we work on the hand muscles. Along with that, the major portion that we covered is the sensory processing skills. In the sensory processing skills, when we are talking about your five senses, which is touch, smell, taste, vestibular, and proprioception. So when children gets an occupational therapy services, most of the times the parents are concerned that children are not sitting. So we work on their attention span. We give them a therapy in a way that children kind of like get the feedback into their body and they're able to sit down on the table and chair and attend to a short task. We kind of work on a lot of sensitivities. So a lot of children with autism has an issue touching different texture. For me and you, it's normal to hear certain sounds of vacuum, blender. But when children with autism, they hear that voices, it's really threatening for them. You'll immediately see them like covering ears or like hiding under the tunnel or somewhere because they want to avoid that. So we as an OT, we kind of like use different kind of like desensitization techniques. So this way the child starts kind of tolerating those voices. Children started kind of touching different materials because think about it, when you were little you were touching all these different objects, you were putting in their mouths, you're hearing lot of loud noises and everything. If none of those things you've been explored, how would you learn as an adult that what's the real world looks like? So it's very important at the young age the children's kind of like desensitized because we don't want the child to leave alone that, oh, we are not going to do the vacuum because my child is scared. Instead of that, we will, as an OT, we're going to work on the desensitizations. So the child is okay if he goes outside. Child is okay when he's in the bus. Child is okay going to the mall where a lot of people are there. So as an OT, we have like a very, very big role when it comes to the working with children with autism.
Yes. So, doctor, do children with autism commonly suffer from other illnesses or problems as well?
Yes. So depends on the sometimes that we call the comorbidity, which is children with autism could have also learning disability, which also impacts the progress. Sometimes children with autism could also have mental retardation. That can also cause a problem. A lot of times the children with autism could have just very severe low muscle tone or very severe speech delays. So when you're working with this child, you're not just working in a pieces, you're working as a whole body, like a whole human. You can't just say like, I am an occupational therapist, so I will only focus on his hand. Or I am a physical therapist, I will only focus on his lower body. We have to work as a whole, like a holistic approach we use when we're working with the children, and especially children with autism, because there are times that children will have more than just the autism. But autism is a very easy to diagnose, so it is a main symptoms you will see when children has an autism.
So, I've heard that the symptoms of autism are exaggerated and incorrectly portrayed around media, especially social media. So, what exactly should the parent avoid thinking or overthinking if something is happening with this child?
Yes. So first of all, parents has to, as I said, accept it. If your doctor is telling you to check the child more further and see what child has it, accept it. Do not get scared that what happens if they are going to diagnose with autism, because that's the first fear. If you are not going to able to accept the reality, how would you help your child? You have to really accept it first. Also, a lot of times the parents are kind of like, oh, if my child is autistic, people think it's he's a mentally ill, and it's really a taboo in our society because people looks those children differently. People look those parents differently because they think their children are not good to play with our children. So that's a big thing also when it comes to as a mental illness, because autism is not a mental illness. Autism is a developmental disorder. It is a neurological disorder. It is definitely not a mental disorder. Children with autism has a communication delays, as I said, has a problem communicating with you, understanding the emotions. But there are so many positive aspects the children with autism has it too. You will see a child with autism draws beautifully. You will see the child with autism sings beautifully. So there are many positive things. So first of all, parents have to not hear anything in the media if they're seeing negative about autism. Another thing is a lot of in the media we hear like autism is caused by the vaccine. So do not give the vaccines to your child. There is no proof that children are getting diagnosed with the vaccine. So some of those things, like if they're hearing in the media, they definitely want to like ask the professionals. They really want to seek the help from the professionals. If they are well educated, like go and find some research based evidence before they kind of believe that this can cause a problem by doing it. Because I do remember a lot of children's parents, they don't want to give them a vaccine, but vaccine is important. You can't go without you can't take a risk of not having child a vaccine just because you think the vaccine will cause the autism. So I would definitely say that parents, like when it comes to your child, like you listen to the media, but you also use your own research. And the best thing is ask help. If you know there is so many support groups, you can post your question into support groups on a Facebook or various groups, and use the social media as a positive approach for you and to gain more knowledge rather than being scared and what you hear from the social media.
Yes. So, doctor, so what would you advise? What advice would you give on your experience, based on your experience, for the parents watching the show right now?
I would definitely say, and I will also, you can leave it also the website. I have a website. Definitely reach out to the website. It's www.stepstosuccessot.com. I am an occupational therapist. There will be many other professionals. If you know any professional, feel free to ask a question. First of all, do not hesitate. All professionals, no matter we are your therapist or not, I always tell the parents, if you ask me a question, it's not going to cost you anything, because we all want to help you. We are the expert on this field and we want to help as much as we can in our community. So if you are being aware, you know any therapist around the area, if you feel like you are concerned about the child, please, please, please go seek help. First of all, speak to the pediatrician. So that's what one advice is: early detection. As early as you're going to find a problem, you're going to work on it and you will see the result. Ignoring the problem will never help anyone, regardless, right? So, and then once you find the problem, do not get stressed. Don't think about, oh, my son is going to go to the college. Is he going to do the high school? Is he going to become a pilot or doctor? That's very far away. Just accept it that this is the problem, my child has it. And I, as a mom, I, as a dad, I, as a parent, we want to help our child. So that's second thing. Early detection, accept it, get more educated. I have a lot of families here that I've been working with them, and their parents become very knowledgeable into these topics, and they are running support groups. They are so knowledgeable with all this therapy they're receiving from us and learning from us, and they become a strong advocate for their other children and helping other families. So be one of those person that you want to learn about this thing and you want to help others in the community. Your child has it, probably other children has it too. and join the support group. Nothing to worry about because the help is available. And if the help is available, take it. So, best thing I would say, early detection, early intervention services we have in here in the United States. So, what services you have available there? Just seek for help. There are many, many resources. I mean, Google is best, YouTube is best. You can ask the question to the professional. If you see someone in a Facebook, just message them. What do you think about it? But as I said, just being aware the word is autism, being knowledgeable about what signs and symptoms you're looking for. Do not overlook. If you're seeing something your child is doing and it's not correct, don't just close your eyes and think, okay, next year it will be fine. In a few months he will recover. Just get up and seek for the help.
Yes. Thank you so much, Dr. Pallavi, for coming on to our show. We had an amazing time, and yes, we did discuss so many different topics in this field of autism. Thank you again for coming. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.